Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello, everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments, so you can feel normal again and live your life to the fullest. Just a quick bit of housekeeping before I introduce today's special guest. I'm happy to announce that I'm now working on my next book. The title is Reclaim Your Digestive Health and Feel Normal Again, Fixing the Root Cause of Your GI Distress with Natural Treatments. Now, this book should be ready later this year, so keep an eye out for it. Okay, that's it for our housekeeping, so let's get started. Okay, so today's show is all about what does functional medicine do to your brain? Now, my special guest is an expert and someone that I really admire. Her name is Dr. Kelly Brogan. Let me tell you a little bit about her. Now, Dr. Brogan is a holistic women's health psychiatrist and author of A Mind of Your Own. She completed her psychiatric training and fellowship at NYU Medical Center after graduating from Cornell and has a bachelor's from MIT in brain and cognitive science. She's board certified in psychiatry, psychosomatic medicine, and integrative holistic medicine, and is specialized in a root cause resolution approach to psychiatric syndromes and symptoms. Dr. Brogan, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
It's a total pleasure to be here. Thank you for having me.
Now, I know in my private practice at Functional Medicine Ontario, I have very often patients coming in. They have a whole list of symptoms. You know, they're tired, they've got no sex drive, they've got bloating, indigestion, they've gained weight. And typically on that list is something either like depression or anxiety or panic attacks. A lot of people, as you know, are having mental problems. And you're going to explain to us how it's not always in your head.
Yes. So we're at a really funny time, I think, in the history of medicine. And it's easy to get, once you're exposed to the functional medicine model, it's easy to get frustrated with what's going on in the conventional sphere. But the truth is that I think people are waking up to the limitations of a conventional model. And one of the limitations is that conventional doctors, the way I was trained, are not prepared to deal with the complex webs of symptoms that patients are presenting with, as you mentioned. And so what happens is that they don't have the appropriate diagnostic tools from a physiologic standpoint, and they also are very quick to sort of dismiss, what they're not able to diagnose as psychiatric. So in this way, psychiatry has become almost the wastebasket, for all that conventional doctors are unable or unprepared to help patients with. So these are, typical symptoms like brain fog, fatigue, changes in sleep, feelings of malaise and disconnection. Almost always these quote-unquote psychiatric symptoms are accompanied, right, by a host of physical symptoms, whether it's gut dysfunction, skin issues, hair loss, a number of different, sort of autoimmune related symptoms. And so I became very interested in what I call the psychiatric pretenders, right, which are these reversible physiologic imbalances that can masquerade as psychiatric and can, in the wrong hands, garner you a psychiatric diagnosis and potentially, amazingly, a lifetime of treatment with psychiatric medication. So I think of these as being really critical for any physician or clinician to sort of think about when they're meeting with a patient who, otherwise has been potentially slapped with these very impressionistic labels like depression or anxiety, or maybe even bipolar disorder, ADHD, phobias, these other, sort of largely descriptive terms that psychiatrists use because we don't have tests, right? We just have this dictionary of terms that we sort of, poke a finger at a word on a page, and that's how we make, we're trained to make diagnoses. It's very unique among professions in medicine in that way. And so, if I were to consider some of the top ones, two that I see, for example, very, very, very commonly, if not, and probably upwards of 80% in my practice, are the relevance of blood sugar imbalance and also of thyroid dysfunction. So blood sugar imbalance, as you know, is endemic, to our population because we are being exposed to, sugar-based stimulus in our diets that we never have evolved to accommodate. And so our endocrine mechanisms, the natural response on the part of the body, largely in the form of insulin, is just doing what it's built to do, right? But often it sets us up for this roller coaster, right? So you have a bagel for breakfast, you have this massive spike in your blood sugar and an associated cortisol and insulin response that dips you down hypoglycemically. You feel jittery, you feel hungry again and foggy and irritable. And what happens? Then you need a snack an hour and a half later. And people use coffee and people use alcohol and people use, many different types of self-medication to try and stabilize that. But the truth is there's really a simple antidote, and it's cold turkey elimination of sugar while, in my clinical experience, dramatically increasing natural fat intake. And it can, you can shift this in the space of a week to 10 days. Something you've been doing for maybe 30, 40 years, you can largely heal in such a short period of time. So I would say that's one. And another is, as I mentioned, is thyroid dysfunction. I have, a personal story around Hashimoto's and my experience healing Hashimoto's and coming off of thyroid hormone was really my entry point into functional medicine. It was my aha experience, of understanding and appreciating that my body was capable of things that I was told it wasn't in my medical training. And so I've become very intimately familiar with the quote-unquote psychiatric manifestations of thyroid dysfunction. I mean, if you look at the classical symptoms of hypothyroidism and you look at the DSM diagnostic criteria for depression, they match up almost 1-to-1. And so, to not rule out and know how to identify thyroid dysfunction, and of course, it almost always is immune in nature, right? So thyroid dysfunction as a root cause of psychiatric symptoms ranging from postpartum psychosis to, run-of-the-mill depression and anxiety, in my opinion, can be irresponsible, right? Because these women primarily can end up on a prescription for Zoloft or Prozac really for years and years and years, if not decades, if you're not looking in the right places. So I've become very passionate about sort of bringing back an awareness of the connectivity between mind and body and understanding that our experience of mind is really encoded physiologically in our bodies so that when you prioritize healing the body, you can actually, dramatically reduce the signal of psychiatric symptoms. And it's something that, for whatever reason, many doctors are reluctant to consider. But I think there is a growing awareness. I'm hopeful that there's change afoot.
I think there is change afoot. I really do. So for the listeners out there, if you are a loved one or suffering from depression, anxiety, bipolar, fatigue, just feeling lack of concentration, lack of motivation, it's not always all in your head. And Dr. Brogan just told us two big things that she will look for first at the top of her list: blood sugar imbalances and thyroid imbalances. Now, Dr. Brogan, can you talk a little bit more about thyroid imbalances? Because I know for me, a lot of patients come see me at my practice and they're like, I read this stuff on the internet about what's considered, ideal thyroid, but then I go see my family doctor and they tell me everything's normal. And what's the real story? Because I feel like crap.
Yes, yes. So my friend and colleague, I'm sure you know Datis Karazian, wrote a book, right, with that exact title. It's so funny. And actually that book was very helpful for me in my early stages because, I developed postpartum thyroiditis, which is increasingly common, related to, we think, the immune shifts that are native to the postpartum period. But of course, in this sort of chemical soup we live in, it's becoming increasingly common that women are suffering from immune dysregulation and associated stress response dysfunction. So, what I learned about postpartum thyroiditis or Hashimoto's, and really applies to Graves and really any autoimmune thyroid dysfunction, is that it's a message, right? So it's a message from your body, and it's a call to action to take a very comprehensive approach. So that's the beauty of what you do and the message you're trying to get out, and I'm sure a message that's very familiar to your listeners, which is that if you start with these top-down interventions, you don't really even need to know much about how or why they're working, but you need to know that the invitation is there. So how do you know the invitation is there? So when I screen for thyroid, which I do in every single patient, I look at a number of different blood parameters. So these are things that, these days you can order yourself on the internet if you can't find a naturopath or open-minded MD or a chiropractor to work with. You can really take matters into your own hands. But, so it would be the most famous parameters, so a TSH, a free T4, and then also a free T3, so the active thyroid hormone. I look for a TSH less than 2, and there's a large body of literature actually at this point substantiating the misleading nature of TSH and the relevance of taking a broader look at different blood parameters. So I look at reverse T3, which can be particularly if someone is taking a Synthroid or a T4 synthetic medication, which can be a very helpful explanation as to why they still have symptoms, even if their TSH looks quote-unquote optimal. And then, of course, I look at antibodies, so thyroid peroxidase, thyroglobulin, and thyroid-stimulating antibodies, just to sort of contextualize where the root of this dysfunction might be arising from. Then it becomes clinical. So I care about the numbers diagnostically, largely, but if a patient has all of the classical symptoms, right? So constipation, they have peripheral swelling, they have hair loss, they have cloudiness, they have these inexplicable spikes of anxiety and maybe even racing heart. They feel, what they would characterize as depressed, and there's any of those indicators that are off, then I always start with the same interventions that are very low commitment and low risk, right? So it's dietary first and always first in my practice. So, these patients follow my template protocol, which is nothing fancy, but does include elimination of course, gluten and dairy, specifically also corn and soy. Those are the primary eliminations that happen. In the first month, I have a bit of a more restrictive template with patients where I ask them to also eliminate, all legumes and all grains, but, almost the entirety of my clinical practice ends up eating those things again in the future. And then we look at, what else can we do? So there's specific minerals that have been studied to support thyroid function, of course, selenium, zinc, magnesium, vitamin C. There's also the role of appropriate iron balance. So we can look at mineral support, but then I like to use non-hormonal glandulars. So I use a lot of glandulars in my practice. I learned about this from my mentor, Dr. Nicholas Gonzalez, and it's an amazing tool. So glandulars don't have hormones in them, but they speak to your own glands with growth factors from pasture-raised animals, if you feel ethically comfortable with that. And it's I think a really nice entry point before you get to the point of considering hormone, which really isn't a big deal to trial, of course, but using something like a Nature Throid or Armor or Westroid or compounded product. But I normally start a little bit slower to see if we can just take the burden off the body so that the thyroid can be liberated.
Okay, so going back to the different imbalances that can occur within the body that can masquerade as mental illness. So you talked about blood sugar and thyroid. Can you name maybe 3 or 4 other things that we should be thinking of that patients need to know about?
Certainly. So another huge one, as I've already alluded to, is food intolerance, right? So I'm not personally very big on food allergy testing. I keep it pretty simple in my practice. But I have found that the vast majority of my patients have dramatic improvements when they eliminate gluten and cow dairy. Gluten specifically has an ever-increasing signal of harm in the psychiatric population. There have even been recent randomized placebo-controlled trials, crossover trials, looking at the effects specifically on mood and cognition that gluten can have. And we can have a whole discussion about why that's the case. But the truth is that it's worth a try. Give yourself an opportunity to explore that, and be careful, of course, right? When you eliminate gluten, not to ramp up a bunch of non-organic gluten-free processed foods that contain corn and soy and a ton of sugar, because you could really limit your gains. So gluten intolerance is a major one. I'm also very interested in specific micronutrient deficiency. I have a lot of experience in my practice with B12 deficiency, which is easy to screen for, although obviously not always completely accurate by blood. But you can screen and look for a level. In my practice, I look for a level below 600. And I use injectable B12, which is, probably overkill, and then not always necessary, but I have found that, within the space of 2 to 3 injections given over a couple of days, there can be dramatic shifts in symptoms like energy, low mood, and cloudiness. So, we knew this from my medical training. I knew that B12 was important. I knew that B12 deficiency could cause dementia, there have been case reports of patients who've developed psychotic depression just from a single nutrient deficiency like B12. So, screening for that is important. And then there's the complex milieu of sex hormone imbalance. So many of my patients come to me with premenstrual exacerbations, and the tie-in to diet is very critical here. So when we're looking at premenstrual exacerbations of mood and anxiety symptoms, I often start with, again, a very similar template, but I might consider supplementation with things like Chase Tree, which is also called Vitex, or Maca, for example, or sometimes even bioidentical progesterone. And you can in the space of 2 cycles, resolve what otherwise would have been, again, an SSRI prescription of long duration. So to me, that's really exciting.
So for the listeners out there, again, there are a lot of different things that can be going on in your body that can masquerade as a mental illness. And Dr. Brogan just so eloquently listed off 5 or 6 of them that are actually so common, it's ridiculous. So if we just go back to B12, I've spoken with patients and listeners that I really recommend, whenever they have any blood testing done by any provider, that they get a copy for their own records so that they can see what their numbers are. I know here in Canada, Dr. Brogan, the B12, what's considered normal, is like 125 to 625 or something like that.
Yeah.
And you had mentioned 600, so you want to see a minimum.
Minimum.
So
yeah.
if your numbers are under 600, you should try supplementing with B12.
Yes. Yeah. And one of my favorite case reports, as I mentioned, is, was a woman who was a lifelong vegetarian. And she developed literally psychotic depression, was treated with electroconvulsive therapy and antipsychotics to no avail. finally, after a transfer to another hospital, her B12 level was, I believe, in the high 100s. And so technically normal, right?
Technically normal, yes.
And, they injected her with cyanocobalamin 2 times, and she returned to her baseline, within the space of that treatment. So, this is profound. And I guess the take-home message for listeners is really that depression is a symptom. It's a symptom. It is not a diagnosis. It is not a disease. And if you think of it as a disease or diagnosis, you could really miss an opportunity to discover what that symptom is telling you about your body. So, that's, if nothing else, that's something to remember.
I absolutely love how you just said that. I'm going to steal that and use that in my practice.
Please do. Absolutely. I'd love an echo chamber of that sentiment.
Okay, so if we can kind of go back to blood sugar imbalances, you just kind of breezed over healthy fats in the diet.
Yes.
So if we can get in, talk a little bit about that. I remember listening to you. You spoke in one of the summits last year or the year before that, and you were talking about a smoothie that you have patients do with high, and they put a lot of fat in it.
Yes.
And actually, I took that recipe and I modified it a little bit for myself, because what I was finding was every time I had a smoothie, within an hour I was hungry again, and I have a history of low blood sugar.
Sure.
And I get really crabby
Yes.
when my blood sugar is low. So I took your smoothie recipe and I tweaked it a little bit, and my gosh, I drink my smoothie on the way to the office. I'm drinking and driving with my smoothie on the way to my office, and I have enough energy and get up and go for at least 5 hours to see patients back to back. So tell our listeners about the importance of healthy fats.
Yes. So I discovered this through my own self-experimentation, right, as many of us do, because I went initially gluten and dairy-free, but I still was eating a bunch of processed food, which is easy to do, right, when you are only strictly adhering to that. And I have, burned out my adrenals beyond recognition through my training and general, lack of care of myself for 30 years, pretty much. So I learned that the quickest and best antidote was to use these, if you want to reduce it to slow burning fats, if you want to think about it that way, but these are really complex foods, right? So we're talking about things like egg yolks, like ghee, which is a clarified butter, things like coconut oil, and then of course other vegetarian sources like avocado, nuts and seeds. These are essentially, one of the ways to look at it is they're sort of like big logs you're putting on the fire rather than throwing small little pieces of crumpled paper in all day long. And your hunger level will shift in such a short period of time. I used to walk around, I would have a panic attack if I didn't have a candy bar in my bag or some sort of snack at all times on me. I was hungry constantly. And, this happens patient after patient after patient. It happened to me personally. Within the space of like 3 to 4 weeks, your hunger level, subsides. You're able to click back into a healthier metabolism. Now, it's interesting because when I first that's a fancier word than is necessary, the smoothie recipe, came up with it. A lot of my colleagues were like, where's the kale? Where's the spinach? And while, obviously, any diet is a plant-based diet, hopefully, right? I found that in my particular demographic of patients, 100% of whom are struggling with their mood and with these reactive hypoglycemia symptoms, that actually the more important macronutrients were in the fat category. The more important foods were animal foods, and specifically red meat, actually, than massive quantities like 8 bushels of kale a day. And while I believe passionately that there are different diets for different people, and my work again with Nicholas Gonzalez helped to really reinforce everything I had already learned about Weston Price and this idea that we grew up ancestrally in these different niches. In my particular demographic, there is a template, that is simple, and it really can be a slam dunk in the space of a month. And so obviously, in my book, I go into more detail, of course, in that, but it's easy to learn, and it shouldn't ever feel like deprivation. That's the beauty of this type of dietary approach, is it's like, filling foods that taste good, use natural salt, and make sure that you're enjoying it. That's a critical piece. So you don't feel like you're torturing yourself, right?
Yeah, I just want to thank you for mentioning that smoothie, those ingredients. So what I did was I changed my smoothie. I swapped out some things and I added in 3 raw eggs
Yes.
and a couple of tablespoons. I don't even measure anymore. Just slap it in there of coconut oil and ghee and usually some kind of nut butter. And my gosh, I swear to God, Dr. Brogan, it's changed my life.
It's hilarious. I love it.
I mean, it's so simple, but I want you to know it changed my life.
I love that. I love that feedback. Yeah, my kids even love it. So it tastes like chocolate milk. It's a funny thing, and it would be difficult to eat that much fat just sort of like in your average day. So it is more of like a therapeutic intervention, for a period of your healing. So I'm so glad to hear that. Thanks for sharing.
Well, now, can you tell us a little bit about your new program, Vital Mind Reset?
Yes. So I have, actually, it's probably at the airing of this show just come out. My book is called A Mind of Your Own, and it's essentially a compendium of everything I've learned and unlearned about my medical training, and then with a very succinct 30-day introductory model to pretty much what I do in my practice every day here in New York City. And that's available now, and the follow-up companion to that will be a course, which is a 44-day course, and that's called Vital Mind Reset, and that'll be available in about a month and a half, and it's meant to sort of take it home, so take the work from the book home, and it's, videos and, cheat sheets and recipes and an experiential process that my intention with that was to keep people from having to come in to see me, because I have an enormous wait list, and I, have a lot of trouble seeing patients out of the country. And the truth is, you don't need to come in to see me. You can absolutely do this yourself. And that's really all I do for my patients, is hold the space for them to discover their own potential for self-healing. So I'm pretty passionate about bringing it into the, onto the home computer, and into your home arena. So and that's all, of course, on my website, which is just my name, kellybroganmd.com.
I really believe that technology is going to totally change medicine.
Yes.
Because just like you have, and a lot of other functional medicine doctors out there are putting together these programs that can be done very simply online from the comfort of your own home, because the reality is not everybody can afford us. Not everybody has the time to be, traveling and waiting in the waiting room and whatnot.
Absolutely.
So how can our listeners find out more about you and your program and your book?
Yeah, so just my website is the easiest place. I have obviously an opt-in area, and I have a bunch of stuff I'm offering that I've curated right now. Sort of like free goodies and things like that. So that's just on kellybroganmd.com.
Fantastic. So I'll make sure that link is in the podcast notes. So you can easily find Dr. Brogan's website, her program for Vital Mind Reset, and her new book. Dr. Kelly Brogan, thank you so much for being my special guest today. This has just been an awesome interview.
Oh, it's a total pleasure. Thank you for having me.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.